Seattle, and welcome to NatCon17. Now, when you packed your suitcase, did you imagine you were coming to listen to me rap? I mean, really. Then again, who would have believed that a rapping Alexander Hamilton would take the theater world by storm? Really. And they are amazing. In the words of Eleanor Roosevelt, this is no ordinary time. But the musical Hamilton reminds us that we've faced divisions in our country before. Hamilton believed in a strong central government. Rivals Jefferson and Madison favored states' rights. They had competing visions for America. Now our president is offering his vision of America, one that many agree with and others vigorously oppose. It reminds me of a game I played with my grandson Miles when he was 4 years old. It was a good idea, bad idea game. We went back and forth with questions. Is eating a chocolate chip cookie before lunch a good idea or a bad idea? Is taking off your shoes and walking barefoot in a public park a good idea or a bad idea? It became clear as we played the game that the answer depends on who you are and how you view the world. Today, the stakes are higher than cookies and barefoot walks in the park. But no matter who you are, the one thing that shouldn't be up for debate is the truth. On the campaign trail, President Trump vowed to honor Theodore Roosevelt. In 1900, Roosevelt wrote, "To announce that there must be no criticism of the president, or that we are to stand by the president, right or wrong, is not only unpatriotic and servile, but it is morally treasonable. It is even more important to tell the truth about him than anyone else." In the debate about the American Health Care Act, it was the National Council's right and responsibility to tell the truth. That the American Health Care Act was a very bad idea. And you, all of you, raised your voices through letters and calls and visits, led, I have to say, by the National Council's incredibly policy team, led by Chuck Ngolia and Rebecca Farley, and you responded. And for that, we say to you, well done. Give yourselves a round of applause. In 2008, the voters wanted change just like they did in this election. And the Affordable Care Act created change. It expanded health coverage and promoted the integration of mind and body. Passage of the Excellence in Mental Health Act offered a pathway to equality in the safety net. And the Comprehensive Addiction and Recovery Act authorized more than $180 million a year to fight the opioid epidemic. 8 years made a difference. The Office of National Drug Control Policy was led by a man in recovery. The Surgeon General, who's with us tomorrow, released his groundbreaking report. And the National Council introduced mental health first aid to the American public. And today, I'm proud to announce 1 million Americans have taken the mental health first aid course. Amazing. And everywhere we look, 8 years has made a difference. People young and old, famous and not, are telling their stories of recovery. Had Hillary won, we knew what to expect. The ACA would stay in place, be refined, and eventually all states would expand Medicaid. Well, not everyone thought electing her was a good idea. And we are confronted by a different reality. President Trump and House Republicans laid out a vision of health care as a privilege, not a right. The American Health Care Act replaced subsidies with tax credits, making coverage more expensive, if not out of the reach of working Americans. The plan included more than $800 billion in tax cuts. $800 billion. Do you know how much $800 billion is? We had to look it up. $800 billion would give every teacher in America from kindergarten through high school a $250,000 bonus. It would buy a $4 million home for every homeless family. And better yet, it could put all 535 members of Congress on a Russian rocket to the International Space Station and keep them there until the midterm elections. Instead, $800 billion would have gone to the very richest Americans, with Medicaid footing the bill. Medicaid was cut by $800 billion, the expansion repealed, and the funding formula changed, ending Medicaid as we know it. 24 million people would have lost health care coverage in the richest country in the world. The American Health Care Act was not the National Council's vision for health care in America. We didn't think it was a good idea. We thought it was a bad idea. And it would have been morally treasonable to the American public if we did not tell the truth. And the truth is, the Medicaid expansion has been a success, probably the biggest success of the ACA, and Republican governors have seen the benefits. John Kasich said, "Thank God we expanded Medicaid, because that money is paying for rehabilitation for people." Michigan Governor Rick Snyder says his state saw a huge increase in coverage and a drop in people showing up at the ER without insurance. Vermont Governor Phil Scott put the challenge in stark human terms. This addiction battle continues to be one of the great challenges of our time. How we react and how we choose to respond will be remembered long after our service has ended. In 32 states and the District of Columbia, the Medicaid expansion has given 1.3 million people with a substance use disorder or a mental illness access to care. People like Jessica. Jessica told me that she began drinking at the age of 9, smoking marijuana in middle school, and when others were celebrating their sweet 16, she was shooting up. "I followed the drug," Jessica said. "Wherever the drug was, I was." Then she got lucky. Integrity House in Newark, New Jersey found her. Staff helped her get Medicaid that pays for her therapy and her medication. And Jessica said to us, "I don't want to think about what would happen to me or the other women here if we lose Medicaid. Without Medicaid, I don't know if I will last. I don't know if I will last." Millions of people rely on Medicaid so they can last. Real people. People like Sam. Sam and I did an interview together just a few weeks ago for USA Today, and he described struggling with mental illness since he was a teen. It took him to dark places, living on the streets, 5 suicide attempts, and prison. But Sam is a success story. The McClendon Center in DC that you saw on that opening video got him Medicaid under the expansion, and he's getting outpatient psychiatric help for the first time at the age of 53. At a time when many of us are looking back at our glory days, Sam's life is just beginning. The truth is, if the American Health Care Act becomes the law of the land, we won't have to wonder what happens to all the Sams and Jessicas we know. Federal funding for Medicaid slashed, the fiscal pressures on states that have to really balance their budgets every year, insurmountable. Who would be cut? Pregnant women and children, people who are elderly and disabled, people with mental illnesses and addictions? And which staff would you lay off? Because the truth is, states would be forced to not only cut who's covered and what's covered, but they also will cut the rates they pay. We don't have to answer these questions today. For now, we escaped a bill that cripples Medicaid, the single most important funder of mental health and addiction treatment. But we don't know what the next steps will be. What we do know is that the National Council, our board, and our members are in it for the long haul. That it is our right and our responsibility to question any bill and any executive order that could hurt the millions of Americans living with mental illnesses and addictions. Gloria Steinem said, "God may be in the details, but the goddess is in the questions." Once we begin to ask them, there is no turning back. And the National Council asks questions. In a nation where half of Americans believe that 40% of the population works for the government when it's less than 2%, and that 1/4 of the federal budget goes to foreign aid when it's less than 1%, and with 35% of Americans either don't know or aren't sure that Obamacare and the Affordable Care Act are the same thing. We need facts, and not just from our elected officials. At any time, the National Council is leading 30 to 40 initiatives examining the delivery of addiction and mental health services, looking for facts about policies and practices. So what have we learned? We've learned that it's easier for states to move money from government to manage care, from carve-outs to carve-ins, than it is for them to invest in the actual delivery of integrated care. Integrating funding for administrative streamlining and promised savings makes sense, but it doesn't automatically result in integrated care or better care. And just calling something healthcare reform doesn't make it true. We've learned that it's easier for funders to start fresh, financing a new group or organization or program, than it is to invest in retooling existing services. But each time you create a new organization, you spread limited money a little more thinly, and you allow people to fall through yet another crack. We've learned that it's easier to compare mental health and addiction organizations to federally qualified health centers than it is to understand the fundamental difference between them. Our member health centers get cost-based reimbursement, called prospective payment. Their Medicaid rates go up as they hire and train staff, raise salaries, and build new buildings. Most of our behavioral health center members haven't seen a rate increase in years. They have no money to cover the cost of adequate salaries that would allow them to recruit and retain staff, or to make badly needed capital investments or improvements. These lessons drove the 2014 Excellence in Mental Health Act. 8 states are creating certified community behavioral health clinics, aligning effective practice with adequate payment. And with our congressional champions on both sides of the aisle, we'll drive to expand to additional states. Even in 2017, yes, we will do it. Even in 2017, when we're playing policy defense, we're still securing the field for an offensive strategy. I made an analogy, right? Football, I think it is. I worked on that. I actually had to check it out with some people who know sports. But what we've learned from our practice improvement work isn't limited to policy. Over the next 3 days, many of you will showcase your creativity. That despite daunting fiscal and regulatory barriers, you're driven to be better leaders, to create better workplaces, and to be better partners to your patients. And together we've learned that when we adopt measurement-based care, using standardized instruments like the PHQ-9 and the DLA-20, patients improve. When we stop hiding behind HIPAA and 42 CFR, and we engage the most important people in a patient's life, their family, readmissions go down. When we add cognitive therapies and medication-assisted treatment to the holy grail of 12-step programs, we increase opportunities for recovery. And the fact is, managed care, hospitals, and private equity that have been competitors now increasingly are our partners. Partners because we need each other. Do you remember when taking a car trip meant checking your oil, filling the gas tank, and grabbing a handful of maps or maybe a triptych? Did anyone remember triptychs? Today, the car tells you when the oil is low, you may plug it in rather than gas it up, and your GPS directs your every movement. Better yet, like me, you might call Uber or Lyft. Better still, your car may drive itself. The vision of the fully connected car is one that sounds more like our iPhones than our Hondas. General Motors, the legacy car maker once left for dead, understands this evolution. CEO Mary Barra knew the world saw GM as old school, looking instead to Tesla, Google, and Apple to redefine the auto industry. But under her leadership, GM is leaning heavily into ride-sharing, electric vehicles, and autonomous driving technology. But they also continue to do what they do best. They discovered something fascinating during this process. What they've discovered is just as much as they need the tech companies to evolve, the truth is that tech companies need the car manufacturers. As Fast Company put it, despite all of Silicon Valley's astonishing accomplishments, it turns out that safely moving human beings over high speeds, over great distances, is, well, pretty hard to do. The same thing is true of healthcare. As much as we need to get wired, emailing and texting with patients, offering online coaching and treatment, and promoting virtual communities, as much as we need big data to drive policy to inform treatment and to measure our impact, as much as we need forward-thinking companies like a Novotel, cutting-edge apps like MyStrength, and game-changing innovations like you'll find in our Solutions Pavilion. The truth is, it turns out for all their ingenuity, high tech needs us. Children repeatedly exposed to violence, women middle-aged, using and unemployed, veterans hearing voices and living on the streets all need your human touch. It's not us versus them, app versus human, primary care versus behavioral health, hospitals and insurers versus community agencies. It's about us and them, working together in new partnerships. This conference is filled with workshops, thought leader sessions, and TED Talks that show us how we're in this together. We know that it takes time and money to step out of the important work you do every day and join us here, and we are very grateful. In return, you'll be taken care of by the National Council's very talented staff. You'll recognize them by their smiles and their blue ties and blue scarves. Attending to your every conference detail is our Executive Vice President, Chief Operating Officer, and Conference Leader Extraordinaire, Jeannie Campbell. And you'll be warmly greeted, they were holding those seat signs, by our board of directors, led by our chair, Susan Blue. Susan has a vision for our work and leads us with quiet assurance into the future. And be sure to visit, yes, somebody, Susan, yes, I think she's over there. And be sure to visit the Solutions Pavilion to have your questions answered, your makeup done, and your neck massaged. And tomorrow night, walk the red carpet with me at what we call the National Council's Oscars and toast our honorees. We are all in this together. And this year, our work cannot end on Wednesday. Nobel laureate and Holocaust survivor Elie Wiesel said, "There may be times when we are powerless to prevent injustice, but there must never be a time when we fail to protest." You protested the American Health Care Act, and you prevented injustice. But the ACA has to be operated and improved for it to succeed. We need a commitment to mandated enrollment, funding for deductibles, and insurance competition. Instead, the president has said that the ACA is collapsing, and he threatened to let it explode. Make no mistake, this would be a crisis manufactured by neglecting and undermining the ACA. And if the ceasefire ends, the schism in the Republican Party will heal, and it will bring back legislation that enshrines health care as a privilege. No matter your political persuasion, no matter who you voted for in the election, it's highly unlikely that you'd be in this room if you believed that taking care away from working people, from the poor, from the sick is a good idea. Together we can do three things. First, keep the National Council's Unite for Behavioral Health page bookmarked. You'll find op-eds, letters, and scripts. And let's take advantage of this window of opportunity to expand Medicaid. Kansas, North Carolina, Maine, Georgia are among the possibilities. We're there to help you move that agenda. Second, even while you're here, open your conference app, tap the Write Your Legislator icon, enter your address, and give thanks to those on both sides of the aisle that oppose the American Health Care Act, and tell your legislators to vote against any proposal that harms addiction and mental health care. Third and last, be in DC October 2nd and 3rd and join the National Council and 14 other national organizations as en masse we take the Hill. Our policy team is at the Capitol every day. They know the difference that speaking out makes. We need to keep up the pressure and the promise. In every town, we see successes. Men and women who 50 or 60 years ago would have languished 100 to a ward, now thriving in the community. Children and parents who just a few years ago would have been separated, now learning to be a family together. And young adults who once fell through the cracks, now taking charge of their lives. Yet in every town, we see the unmet need, young, pregnant women with untreated addiction living on the streets. Older adults, isolated, anxious, and at risk for suicide. Mentally ill men and women released from jails without a place to live. and everywhere treatment capacity that desperately needs to be expanded. New York Times columnist Paul Krugman spelled out a definition of shared sacrifice right now in our country. The poor must accept the dismantling of Medicaid, and the rich must accept big cuts in the taxes they pay. Now, we're not just talking about numbers, we're talking about people's lives. People like 37-year-old Mike Price of Goodyear, Arizona, struggling to pay for leukemia treatment, his house in foreclosure. He thought he was lucky. He got Medicaid. Until 2010, when facing a budget deficit, Arizona changed the rules and eliminated coverage for transplants. Mark died because under the new rules, Medicaid wouldn't pay for his bone marrow transplant. Even my now 10-year-old grandson, Miles, would know the answer to the question, is that a good idea or bad idea? We won round one of the battle, but the healthcare war is far from over. This is no ordinary time. A mean wind is blowing. Our good friend and champion Patrick Kennedy is with us. So let me close with a quote that always inspires me, a quote from his father, the late, great Senator Ted Kennedy. "This is the cause of my life, that we guarantee that every American, North, South, East, West, young and old, will have decent quality health care as a fundamental right and not a privilege. The work begins anew, the hope rises again, and the dream lives on. Please join the National Council in our fight to keep the dream alive." Thank you.